Hey everyone. So, I was watching the news today and noticed that the government sent a ship, a military ship, down to South America. Uh, just basically a medical ship for free health care, to provide free health care down in the region. Now, I don't have a problem with this because I think those people, the needy people there, it's a great opportunity for them to be seen by doctors and the people that can't afford it. I mean, that's a good thing. Don't necessarily like the fact that the government is using this obviously for political gain, just like other governments. Castro has been sending doctors down there for years to gain influence, to gain favor in the region as well. The thing that sort of sticks in my side is the fact that we have millions of people here that need help with healthcare. Now, for people who are not familiar, who may not be familiar with what exactly goes on, a lot of kids here do have free health care. A lot of poor people have free health care. Obviously, the wealthy have health care. I have health care. I have health insurance. I'm one of the lucky ones, one of the many lucky ones that live in this country that can afford to work or has a company that still provides a pretty decent healthcare plan. Now, the people that really have problems are the people caught in limbo, as I like to call it. What I mean is, if you make a certain amount of money, then you don't qualify for Medicaid, which is the government paying for your health insurance, or the government picking up the tab. So what ends up happening is, either you go and hide all your assets and lie and say that you're meeting the minimum requirements to pick up Medicaid, or you go into debt. And you know how it is. If you need health care, if you need an operation, to live, you're gonna do whatever it takes to live. You'll worry about paying the bills later. So it just sort of bothered me, I guess, that we can afford to send a ship down or send medics to other places and provide free health care, but in other words, we're not even taking care of the people within our own country here in the United States. This goes right along with the fact that billions of dollars are being spent in other regions of the world, particularly Iraq, and that could go a long way towards some kind of a national health care plan. Now, I will say that I would like to invite people from other countries to let me know what they think about their health care in their country. I realize I'm not naive. First of all, nobody really has free health care. People pay high taxes in countries that do have socialized systems for their health care. And I also realize that even in Canada, for certain operations, you may be waiting 4 or 5 weeks, maybe 2 months, 3 months, and some people don't really have the time. In fact, I saw a news program the other day where a lady from Canada came to the United States, and if she wouldn't have come and she had to wait in Canada, she would be dead. So she came and paid the money so she could be seen within a few days. So I realize that socialized medicine has its problems as well. I'm not naive to that. So yeah, I'd like some responses here people let me know what they think about their healthcare in their country. Um, is it worth it? As far as the high taxes. Now, when you say that we pay, I'm saying that people that have socialized medicine pay taxes, high taxes. I mean, yes, here in the United States, we do pay premiums for insurance, and then we pay for office visits. So it's not entirely like if you have health care insurance that you're not paying taxes yourself, because you do. You're paying every paycheck. I have so much money that goes to my health insurance. I think we in this country, I'm trying to figure out a solution. What's the real good solution? Because I'll tell you, I love the fact that I can walk in to a hospital and be seen relatively quickly in a very clean hospital, with, qualified people. I've been to a doctor. Now, I did like it. I'm not complaining. When I was in Spain, I had to go to the hospital, and it reminded me of Charity Hospital in New Orleans. Just the way it looked. Everybody was sitting in there. It was pretty slow, but listen, it was free, and they didn't charge me a dime. And it wasn't anything major, but it was nice to be seen by a doctor, and I'm not complaining. I also had to go to the hospital in Canada. That was a little bit different experience because I had insurance, but they wanted me to pretty much pay up front because they didn't want to have to deal with the insurance company themselves, and they felt really embarrassed about it. So it wasn't free there for people who weren't paying into the system. Spain was a little bit different situation. So anyway, I'm just rambling on. I'm just trying to vent a little bit. Healthcare and education and the Gulf Coast not being rebuilt is just really a thorn in my side. It's, you think that would be the first place that we would want to take care of is people that actually pay the taxes. You would think that the first people to get their money back and when they're in need would be the people who pay their own taxes. But doesn't always happen that way. I don't know. I'm wondering if some kind of having a private, like for instance, I also saw something in Canada that said that there's a lot of private hospitals springing up there that are illegal, but the fact there is a market for it because people are tired of waiting, so they go to the private hospitals. And also the socialized medicine is overwhelmed, and that's why the lines are so long. So there's a lot of those. So I'm thinking, well, maybe that's something that could be done here. Maybe get you can go to a private hospital if you have the means, but there should be a backup system or a some kind of the military has. That's basically what the military is. They have people that go to school, get and through the military become doctors, and then have to serve so much time. And so that's what makes the healthcare affordable in the military. Maybe we could do something like that. Anyway, I welcome any ideas. I welcome any comments. I certainly would like to hear from people from a different perspective from other countries. To me, this isn't a Republican or Democrat issue, and it's not a conservative or liberal issue. It's just a human issue. And I certainly would like to invite anyone's comments on it. I'd actually like to hear something from people. So I'm trying to think if there's anything else I'd like to say before I sign off here. Nope, I guess not. So yeah, I invite your replies. Thanks very much. Peace out.